It's very important for patients with heart disease not to delay, particularly if they've developed symptoms, not to delay presenting to their doctor. The reason for that is that heart attack in particular can cause damage to the heart that can be irreversible. And so a blockage in a heart blood vessel called the coronary artery is what causes a heart attack. And that injury can be permanent. So we want to get the patient to the hospital as quickly as possible so that we can open up the blocked blood vessel and provide blood flow back to the heart muscle, and that relieves the problem. The longer that process takes, so the longer the blockage is there, the more damage is being done to the heart. And we say time is muscle, and for that reason what we're getting at is that the longer you wait, the more muscle you may damage. And ultimately the heart's just a muscle, it's just a pumping muscle. That's actually, all it's really there to do is to pump blood around the body. And so you don't want to injure that muscle because it's the pump that you need to perfuse your body with oxygen. The longer you wait on a heart attack, the more injury that can occur to the heart muscle, and that injury can be irreversible. And so patients who wait long, who've had a bigger heart attack by virtue of waiting before they present to the hospital, can have more injury to the heart muscle and therefore are more likely to have a damaged pumping function of the heart, which can cause heart failure. So heart failure would be one of the big consequences of a delayed presentation with a heart attack. Unfortunately, some patients who delay presenting to the hospital with a heart attack may not survive, and so a heart attack is a really serious condition which is associated, unfortunately, with death in some cases. Other patients can develop mechanical complications whereby the damage to the heart is significant enough that there is a structural problem with the heart, like a hole in the heart. And we used to see that more commonly back in the old days before we did coronary angiograms and stents to open up these blockages in the setting of a heart attack. So before we were able to do the procedures that open up the blockage, we would see these complications. Since COVID has come, we've seen some patients waiting longer than they would otherwise be waiting, who've also developed these complications that we haven't seen for many years. And again, that's mostly a consequence of presenting later than they would have otherwise likely presented without COVID being around. The most common symptom of a heart attack is chest pain or chest tightness. It usually occurs spontaneously or suddenly. It can occur in the context of physical exertion or emotional stress. Generally speaking, the pain is quite significant. It can radiate up into the left shoulder or into the jaw and down the left arm. The pain can be perceived to be a tightness or a squeezing, and some patients will say they don't feel pain, they just feel a discomfort or a pressure. But it's that same symptom in the chest radiating to the left arm or jaw that concerns us for a heart condition. And then usually it's associated with some other symptoms like shortness of breath, some nausea or sweatiness. The hospitals are safe, they're open for business. So if you have concerning symptoms for heart disease, or if you have a known history of heart disease and develop new symptoms, it's really crucial that you seek prompt medical care. Waiting on these symptoms and not seeking prompt medical care can result in adverse health outcomes and potentially could put you at risk for serious complications. And so it's critical that we encourage patients who develop symptoms to present as promptly as possible so that we can give them treatment as promptly as possible. If your heart says so, just go.